Intramuscular (IM) injections are widely used in healthcare to administer medications that need to be absorbed into muscle tissue. The gluteal region, including the ventrogluteal area when appropriate, is one of the sites healthcare professionals may select based on the medication, patient assessment, and current clinical guidelines. Safe IM injection practice requires professional education, clinical judgment, and careful attention to patient safety. Every successful injection begins with preparation. The healthcare professional first reviews the physician's prescription and verifies the patient's identity using approved identification methods. The medication name, dosage, expiration date, route of administration, and any allergies are carefully checked. These important safety measures help reduce medication errors and ensure the correct treatment is provided. Hand hygiene is performed before touching any equipment or preparing the medication. Sterile supplies are organized on a clean workspace, and the medication is prepared using aseptic technique according to professional standards. Maintaining a clean environment is essential for infection prevention. Patient communication is equally important. Before the procedure, the healthcare professional explains why the medication is needed, what the patient can expect during the injection, and answers any questions. Clear communication helps reduce anxiety and builds trust between the patient and the healthcare provider. The patient is then positioned comfortably while maintaining privacy and dignity. Healthcare professionals use accepted anatomical landmarks and evidence-based clinical guidelines to identify an appropriate injection site. The ventrogluteal site is commonly preferred for many adult IM injections because it is well away from major nerves and blood vessels, although site selection always depends on the medication, patient characteristics, and institutional policy. Once the appropriate site has been identified, the skin is cleaned with an approved antiseptic and allowed to dry completely. The healthcare professional follows established clinical protocols while administering the medication. Throughout the procedure, the patient's comfort and response are monitored, and reassurance is provided if needed. After the medication has been administered, the needle and syringe are immediately discarded into an approved sharps container without recapping. Safe disposal helps protect healthcare workers, patients, and others from accidental needle stick injuries. Documentation is another essential part of the procedure. The healthcare professional records the medication administered, dosage, route, injection site, time, and any observations about the patient's response. Accurate documentation supports continuity of care and provides an important medical record. Following the injection, the patient may remain under observation according to clinical policy, particularly if the medication is N.